Welcome back, folks. This is episode number 4 of Being Bipolar. I think this episode I'm going to piggyback on a genius, John Oliver, on HBO. His writers, everything about that show is genius, period. But the last episode was about mental health care. And a lot of things that were spoken during that episode, I have felt and dealt with personally. Now, the best health care I had received throughout my life was at a prison. And the programs they had us on, it changed my outlook. And after that, I no longer got into any kind of trouble. I was more honest about who I should be, and the programs also helped me realize the people that were involved in all of the situations that I screwed up. And John Oliver also brought up the fact that the healthcare system really do not have enough people getting involved. Now, when I was in the prison, they had interns come in from the different schools, and they were basically interning for a month, learning the ropes at a prison. So I guess chalk one up on the resume, however you want to work it. But a lot of them had different ideas. So one of the things as a group going through therapy is that we had a circle that we all sat in, and every morning we made decisions on what we do during the day. A basic program. Well, we had interns coming in through the circle and giving us their input and their ideas. The next generation, they came up with some great things. And they were on us. I was going through therapy 3 times a week. They were checking up every time with our meds, making sure, doing the blood draws, everything. They were on cue. These different programs that we had help us realize what triggers were coming at us, what was involved in figuring out what these triggers were, and how to deal with them. Also, the fact that we realized we were not alone. Everybody had a different illness to deal with. But as a group, somebody had an idea for somebody else's issue. We thought about it, and that person had the ability to use somebody else's idea. And that's basically what I'm doing with this program. I want to give someone out there an example of what I had gone through with the mental health facilities, people, issues, everything that come about to where I am today. Somebody out there is feeling the same. So if you can use my, I would say, experience to better your situation, then do it. Please, by all means. But as John Oliver also stated, that there are no people wanting these jobs because there's no incentive. There's no reason for them to. Uh, the let's say the government, the states, they should be sponsoring these people. These people should be treated like teachers. We need more therapists. We need more teachers. We need a lot more nurses. They're quitting. They're going off and finding something 9 to 5 at home. You know, it's not worth it to some people to go through what they're going through now, and they're not getting paid for it. They get into this life, they get into this going to school every day to educate themselves to make somebody else's life better. These people have a heart of gold, and therapists are a dime a dozen, and they need to come out of the woodwork. They need to get educated and get into the boxing ring because this is a fight. We need more people who care enough to help others in the mental health care system. We need to give these people my biggest thing, one of them anyway, is that anybody who is in a profession that helps others, I'm talking about medical, the mental, the ambulance people, the doctors, the nurses, the administration, everybody that has a job that is helping others, even teachers and professors, all their health care should be free. It should be paid for by the state. Hell, I would pay more taxes knowing that the the medical community has one less thing to worry about. They can worry more about educating themselves to make people feel better. Little things like that. Uh, Pay for their education. In the medical field, the state should take care of their tuition, or their books, their food, their housing. I mean, uh, give them a reason to help. Give them the reason to flourish. Every person out there is you can use the onion where you peel them off, or you can use the flour. Either way, each person has that in us, and if we get some kind of help towards a goal that we want to achieve badly, that's one step closer, knowing that you have someone or something out there that's helping you. That's even better. Hope is a big thing, people, especially when you have mental illness. I see it every day, either on the news or everyday people you talk to, even TikTok. You see there are some issues out there. And if you notice it, especially in yourself, then you need to see a therapist. How? Well, I have to say, the county that I live in is doing a really good job in taking care of me. They actually have therapists in system, in the play, that will guide you into other government, let's say, programs that will help you as well. My therapist personally has helped and guided me through all the red tape, all the BS. Okay, and she has done a wonderful job making sure that I'm okay. She calls me personally because she knows that I'm going through a very rough time. And she supports the things that I feel like I need to achieve. She knows what direction I need to go in, and she's there to help me and support me. Now, because the county and the state has a great support system for the mental health community, we are able to help others. Now, I can't say for other states, I've been incarcerated for my mental illness in a couple of them, and I was mistreated in one of those states. It was a rush job. Like John Oliver had said, that the more of the places that we're going in, like the prison, for instance, it was better for me. But the institutions that I was in beforehand, I was brought into the door, given a bunch of medication that made me a zombie. I ate yogurt, I ate bread products, and nobody was checking me for my diabetes. I was basically in bed for 2 weeks while they were feeding me a double dosage of two medications that would basically make you a zombie. I would piss in my bed because I didn't know where I was. So it all depends on the state that you live in, on the treatment that you will get. I've got to tell you, it's really scary when you have no idea what's going on in your mind and you actually get the guts to ask for help. You make a phone call or you get online and all of a sudden you can't get in. You are on a waiting list, or they're busy, or you have to fill out a 50-page essay report slash yes, no, true, false questions. Then you get like 100 A, B, C, D questions, just basically to tell you that there's something wrong and you need to make appointment as soon as possible. A lot of that happened as I was going through all this. So when you come out, don't just look for a therapist. Find somebody in your inner circle that you trust enough that you can tell what is actually going on and what you're feeling, and making sure that person that you trust is understanding where you're coming from, because they're going to have no idea and you might scare them. But if there's somebody that you trust and love, talk to them. Now, John Oliver also brought in a lot of different things about the healthcare that, money wise, however you want to deal with it. But I can't look at it through my eyes because I'm one of those that have been through the different institutions. And I finally learned when I went to prison from doing some really stupid things. That's when I realized. And a couple years later, I applied for Social Security because I could not function correctly without the proper guidance, the proper medication. At the time, I couldn't even self-medicate. So, my wife, at the time, she was a girlfriend. She helped me. We went through the paperwork. We got on the disability to where I could get the Medicare, which was a real big thing. Medicare is really good when it comes to your mental illness. Now, if you start talking to somebody in the therapy field that you're comfortable with and that is billing the Medicare, then you start getting reports going into your Social Security. They're going to check in and see how you're doing and how you're progressing or digressing. They have people that do all that medical background stuff for you. And they do periodical checks. But I've been on it for 10 years now. And I am digressing. Medically, mentally, physically, I am going downhill. But at least I have hope. Okay, because of my therapist and the help that I'm getting from my mental health care facility, I am going to start college courses to help me become a therapist. And my biggest thing will be going to the prisons and start working on like a pay it forward program. Not some religious cult crap thing. I'm talking about what makes you feel good inside. If you have a mental issue that is stopping you from enjoying something, then let's work on enjoying something else. Let's go in a different direction. It'll take time. Once the mind is used to going in one particular direction, it becomes comfortable. Okay, so you got to get out of that comfort zone in order to find out what really makes you happy. And sometimes you're going to break hearts. Sometimes you're going to hurt people, whether it's intentional or not. And if you have somebody that you haven't hurt that you can talk to about it, 9 times out of 10, you're going to end up feeling you owe this person an apology. You'll go, you'll confess, you'll tell them what really was going on. Apologize. It's not being the bigger person. It's just realizing that you don't want to treat people like that. One of the biggest goals I have tried my best and I'm working really hard on is I want to treat people the way I want to be treated. Okay, I don't care if it comes from the Bible or anywhere else. I hear it every day in my head. When I wake up from a nap, I think, okay, who am I going to talk to today? Who would I like to be a part of my life? And a lot of that is because of my little talks with Patricia, that I'm able to realize that I can get outside of my comfort zone. I have an issue of going out into public. I have a phobia of it. And I have to deal with that in my own way, and I am doing it step by step. It doesn't help that my medical issues, physical medical issues, are dealing with not being able or having a hard time getting to doctor's appointments because I can't get out. But it all comes to one big thing. I have got to work on me before I start spreading hope. So I'm doing that. And thanks to episodes like John Oliver's, I got to tell you, man, he centers me. He really does. I'll sit there and for hours watch his episodes and realize that there are things out there, news items that we have no idea about. And these guys are researching these things so John can bring up a funny satire. And it is funny, but it also makes you think. Because a lot of the points that he comes up with, like with the mental health care episode, a lot of those things are issues that people don't realize. They don't comprehend. It's the small things that are issues with people like myself. the small things add up and they build up and build up. And if we can't deal with the small things when they come at us, then we'll forget. And then it'll hit us, surprise us, throw us off our game, and it'll be back to square one. So, the end of this episode, everybody, is enjoy John Oliver, okay? And if anything, try and find somebody to talk to. Therapists are great when you find somebody that you can actually trust, if not a loved one. And don't try to hurt anybody in the process. It's all fun and games until somebody loses an eye. So, peace out. This is Doobie Snacks. Have a good one, y'all.